Hello, this is Cloudy Bell. You are welcome to my channel. I am a registered nurse, RMBSN. If this is your new time here, please click that like button and subscribe so you can get a new update. And if you have been with me, welcome back. Alright, so let's talk about hemorrhoids, health condition called hemorrhoid, also known as bile. So hemorrhoid is a swollen vein in your anus or your rectum. So this is actually not an uncommon thing. So it's basically a common condition, and research have made it known that so many people are passing through this or have experienced this condition. It can happen internal or external. So internal, which is inside our anus, it's really painless, but when it starts to protrude outside, that's when it become a problem, a painful one, because it's getting inflamed and it's swollen. So there are causes or things that do lead or cause hemorrhoid. But first of all, let's talk about the symptoms. So if you are having hemorrhoid, you might be experiencing some pain in your rectal area or your anus, pain, discomfort, itching, swelling around your rectal area. Also, some people can experience bleeding, which usually comes after bowel movement. It can be a bright blood. After they have bowel movement, they will notice a bright blood over there. So if you start to experience something like this, if this is your first time having this type of issue or problem, please, it will be best to seek professional medical advice, or go to your local pharmacist and explain, so they can direct you to the appropriate thing to do or to use. All right, so let's jump into the causes. Causes of hemorrhoid are chronic constipation and diarrhea, whereby you're retaining too much. You're being constipated for a long time, and over time it starts to exert pressure on your rectal area, and this can lead to hemorrhoid or you developing bile. The second one will be standing for too long. Another one will be sitting for too long on a toilet seat, and also straining while you're having bowel movement. It's like you're pushing your whole abdominal organ out, and over time, if you are repeating that over time, you can start to develop hemorrhoid. Pregnancy or childbirth. So when you're pregnant, your baby most of the times exerts pressure on your abdomen or abdominal organ, and if that pushes back downward all the time, that can cause hemorrhoid. So this condition is really a common condition that most people do pass through over the course of their lifetime. So basically, the muscle have lost its strength or elasticity, and it starts to protrude outside, and it can be painful, but it's treatable and preventable. All right, so let's talk about preventative strategies or treatments in dealing with hemorrhoid. So number one, I'm gonna talk about these natural things that you can use to help treat, shrink, and soothe the pain or the itchiness down there as well. So we have number one as aloe vera gel. I'm talking about the natural gel, and if possible, try to use organic stuffs. So aloe vera gel, get a fresh aloe vera leaf, extract the gel inside, and apply it to the area whenever you are having this problem. So aloe vera contains anti-inflammatory properties that can help to soothe the pain, help with the itchiness and the swelling. Also, we have witch hazel. Witch hazel is another known anti-inflammatory agent. It contains tannins. It can help to over time can help to even shrink out the protruded vein or organ, and it can also help to soothe the pain and the irritation down there. Put a little amount in a piece of towel or something, or piece of cloth, and apply it to the area. Another thing will be doing cold compression. Yes, You can either use ice or ice pack, but please do not apply ice directly to your skin. Always put it inside something before applying it to the area to help with soothing the pain and easing the pain around the place and easing the swelling. Another thing you can do is Sitz bath using Epsom salt. So add warm water in a Sitz bowl and add some Epsom salt in it and sit on it for at least 15 minutes to 20 minutes, and do this every 4 to 6 hours every time, and it helps with soothing the itchiness, soothing the pain, and helping with the swelling as well. All right, so the other one is using Epsom salt. So mix Epsom salt 2 tablespoons plus glycerin. So Epsom salt and glycerin mixed equal ratio, and apply it to the area, or put it in something to apply in the area. That helps a lot to soothe the pain and ease the swelling. The other thing you can do is to do apple cider vinegar. This is not recommended for a continuous long-term use, but some people have vouched for this, that it does help to soothe the pain and soothe the itchiness. All right, so also this, if you happen to be doing that, they can help to treat and to relieve the symptoms. Also, you will really need to modify your lifestyle. When you look at the symptoms, it's basically caused by constipation or straining of the abdominal organs or the bowel. So there are lifestyle changes to apply to assist with the other treatments that you're doing. Lifestyle changes like exercising. So physical exercise at least 30 minutes every day will keep your bowel regulated. Also, drink a lot of water. That will help with ease of bowel movement. And also, do not delay. Whenever you feel like you're gonna go have bowel movement, please do not delay, because whenever you are delaying, the bowel, it's already there, and the more you delay, the more it's reabsorbing the water in the area. So the rectal area is reabsorbing the water that would have helped to make the bowel pass off easily and soft and easily. Another thing is, so we mentioned exercise, regular physical exercises, water. Another thing will be high fiber food. So taking quality high fiber food. Some people do psyllium packs. It helps to regulate your bowel, make things easy and smooth, or indulge in eating high fiber healthy diet. All right, I think I said it all. And there is also something that you can do if you happen not to have access to any of these natural things that I mentioned. You can either use over-the-counter creams or ointments like lidocaine, but these are not to be used for a long-term treatment. And before you use that, I'm gonna repeat that again, please. And if this is your first time, please seek advice from a professional medical provider or from a pharmacist. Lidocaine cream can help to ease out the pain and the swelling. Hydrocortisone creams, and simply there is one they call preparation H that can help to treat it faster and shrink it out and reduce the pain. All right, so I hope that you learn 1 or 2 things from this. If you are suffering from that, or if you have someone who is suffering from bowel or hemorrhoid, please do advise them. The major thing in almost every condition, medical condition in life, is exercise, water, and management and prevention strategies. All right, and thank you for watching me again. It's your girl, Cloudy Belle. Bye bye, and make sure you subscribe if you haven't. See you in my next video. See